Hi, my name is Taylor.
I'm Nicole.
And we're going to be discussing the Hearth of Health. We chose the word hearth because it has a symbolism of family, community, kind of the center of a home. And we're going to be discussing the outpatient clinic, primary care, and how that really is the core of our medical system and how we can improve that in the best way possible. Okay.
So just to start, we kind of came up with a mission statement. So basically our mission is to provide personalized whole patient care that focuses on an integrative approach to medical treatment, incorporating a patient's environment, nutrition, mind, body, and community into their care. So kind of all the things that we've learned about each week in this course. And like Taylor said, we're kind of focusing on more like the outpatient aspect, primary care, and then a little bit of derm, of course, also. And basically our goal is to prevent things so that patients don't end up in the hospital and just kind of maximize their overall health. But if they do end up in the hospital, we have Glenn and Karen who gave us a wonderful presentation on what we can do.
Great.
So to start, we wanted to talk a little bit about healing spaces, so kind of something that we talked about this week. These are some like picture examples of what we might want like our waiting rooms and things like that to look like. So very welcoming environments, calming to patients so they're not like stressed. It's a place that they feel like comfortable and happy to be. Abundance of natural light, we talked about that being really important. Calming colors, we talked about that in here as well. Aspects of nature, bringing in plants, things like that, open windows so they can see outside. A location, so hopefully, kind of away from super noisy areas, and then kind of surrounded by trees, nature, things like that, so patients can look out and it's nice. And also if they can't access it, we've talked a lot about accessibility, having trolleys, things like that can bring them to our clinic if needed. Our staff, of course, everyone will be warm, welcoming, very positive, making the patients feel super comfortable and welcomed. And then as for some sustainability aspects, we want to have really large windows, skylights, LED bulbs, energy efficient appliances, solar panels, eco-friendly paints, vertical plants for air purification, things like that. So just kind of trying to think about all these different aspects in our future clinics.
And we want this to be a place that patients want to go to, because oftentimes patients are afraid to go to the doctor's office, or maybe have just a busy schedule, and going to a doctor's office is just an added stress to their life at the moment. So we want it to be somewhere that they would feel comfortable at, feel at peace, and be able to really just be able to open up when they do come. So once they arrive, we'd love to minimize idle waiting. Try to just make sure that all the time that is spent there, it's being used to its maximum efficiency. So in doing so, we would probably try to have some questionnaires and forms given out prior to their arrival, as well as when they do arrive that day. So like a patient who has insomnia, like on their maybe pre-visit questionnaire, we can give them an additional insomnia severity index form that they can fill out while they're waiting, so that can fill up some time. We also want to have some water, tea, coffee available, little snacks for people to enjoy. And then on the tables kind of have some informational pamphlets, magazines available discussing health, exercise habits, stress management techniques, and even have community events and volunteer opportunities out with a calendar of the month and what they can do to get out into the community and promote that relationship aspect of health. Maximizing our patient encounters. So we want our patients to come in and feel open, welcome, like they're in their natural environment at home or in a stress-free environment in general. So we have large rooms, natural sunlight, greenery, and like we had discussed before, the detailed pre-visit intake forms will be reviewed by our physicians beforehand, before coming in, to kind of get an organizational mindset of what we're going to discuss when we see our patients. We want these longer encounters from like 30 to 60 minutes preferably. We're hoping that some of these like pre-visit questionnaires can kind of help in maximizing the amount of time that you're spending actually discussing therapies for a patient and discussing how they feel. We also believe that with these longer encounters, patients will have time to really take their time, not feel rushed, and it will give the physicians the availability to be patient, be curious, ask questions, and really get to develop a relationship with their patient, which will have benefits in the long run as they continue to see their physician. Understand the goals of the patient's visit. be empathetic, curious, listen to what the patient is saying, what they want. Those are all really important aspects that our current medical system kind of rushes through. So we want to emphasize that and developing these strong relationships with our patients among every member in the healthcare team, which we'll discuss some more of the members we'd like to incorporate. Going through a detailed history and physical exam, not just listening to the lungs and the heart, really going through in detail. And then having a patient coordinator come in after each visit to help them in the next steps to accomplish whatever goals we end up discussing and coming up with. So we kind of thought this centralized care, kind of like a mini hospital, but in an outpatient setting. So we would love to have an in-house lab. It would, one, cut costs because you're not sending out these labs to a third party. It would also improve the time in which you would receive results back. And doing these blood draws in the patient room with the in-house lab. So, the physician comes in and then they order the labs, the lab tech will come in along with the patient coordinator and really try to make this process more efficient for patients. An in-house pharmacy as well, ensuring that patients have accessibility to their medications because oftentimes we may prescribe something, but by the time someone goes to a pharmacy, they might be out of it, they may have to wait, and then ends up delaying the time the patient will receive medication if they receive that medication at all, as well as cutting costs in terms of taking out a third-party organization. We would include some various physician specialties in the house, so pediatricians, OBGYNs, dermatologists, psychiatry, all in one location. So it makes it easier for patients to see one doctor and maybe have another appointment scheduled that same day. It also makes it a lot easier for the physicians to communicate with each other and come up with goals for the patient on like a weekly basis or bi-weekly basis. Some additional providers that we would have would be physical therapists, acupuncturists, behavioral therapists, nutritionists, and health coach, all to maximize really the care for the patient. And then just some functional spaces that we would also have, so some mindfulness waiting rooms. Have some rooms that are more so quiet, have nature sounds, really help the patient feel more relaxed outside of whatever busy environment they might have otherwise. Maybe include like some papers and pens, poems, like things that they could do to like journal and reflect. Some art pieces as well. We also would love to have community spaces in the waiting rooms as well, or even after their visit to go in and maybe actually talk with other people and create some friendships. We would have like group puzzles or have a gratitude board to try to facilitate that type of interaction between the patients that are there. And then additionally, we're discussing an herb garden adjacent to a community kitchen. And we would have like gardening classes, composting classes for patients to come in and really learn how to take these things, different things that they learn home with them, as well as walking meditations that Karen mentioned earlier. And then a community kitchen, so we want daily community cooking classes for our patients to come and learn how to cook, and how to incorporate the herbs and spices, and focus more on like plant-based foods and the relationship with their own health, which we'll go into a little bit more when we talk about nutrition. And then lastly, a gym and a spa, focus on more of a rehabilitation center in the practice as well. Space for weekly group exercises, improving our patients' physical and social well-being, being able to incorporate just other people in the community and develop those relationships. And then recovery rooms as well would be available. Okay, so nutrition. We ideally would have our patient counseling, which is something that we're already incorporating into medicine right now. Reviewing our patient's symptoms, doing some daily food intake forms, getting lab results and then giving those dietary recommendations based on our lab results, which are things that we do right now. We'd love to incorporate more advice about the cardiometabolic diet, Mediterranean diet, plant-based diet, depending on the specific goals and needs of the patients that we have. And then ideally working with the patient to find a plan, not just telling them what to do, but what works for you. What do you have access to? Like, how can we better make this work for the entire team? Additionally, having cooking workshops in the kitchen. having different classes like cooking to maximize nutrition intake. How should you cook your food? Should there be like a bright color that comes out? And does that mean that you're getting more nutrients? And teaching them more about that. Some of the things that we've learned in this class. Teaching some more plant-based recipes. Also cultural-based cooking classes. Really diving into the community and getting people to learn about each other and develop those relationships would just be ideal. And then also an opportunity to cook for the community, bringing people together to cook meals and then take those out into the community to those who do not have access. And so just bringing in that whole community aspect, developing relationships, and promoting that sense of purpose among our patients as well. We would also have educational lectures on topics like the diversity of food, understanding our microbiome, how what we eat affects our body in different ways. We potentially have like a hot topics book club on the gut, and have people come in and be able to share what they've learned through different books that they read and just promote that community aspect. And then additionally, interdisciplinary counseling. We want a nutritionist to be on board, a health coach to help ensure that those habits are being created and sustained. Group counseling opportunities, just to try to cut costs in certain ways and allow for more individuals to have access to this. And then potentially having pre-recorded educational nutritional video series that people can access if they can't come into the clinic as often or don't necessarily have the money to pay for these classes. Diving a little bit deeper, we want to discuss the relationship between patient medications and possible nutrient deficiencies, similar to what we've discussed earlier, like diuretics, SSRIs, statins, oral contraceptives, and how those might affect the nutrients in our body and potential nutrient deficiencies that may develop because of it. And additionally, the reciprocal effect of food and the drugs that we have and their effect on metabolic enzymes, so like grapefruit, for example, and CYP3A4. Additionally, we'd love to have personalized labs, comprehensive stool analysis, just a ton of labs to help us really focus in on what exactly this individual patient has going on and provide more of a personalized approach to their care. And then a food diary with possible elimination diet, and just more personalized nutritional recommendations, a take-home grocery list, a weekly meal plan, just giving them an idea of how they can take these things that they're running home with them.
Okay, so now we're going to go a little bit more into like the mind-body aspect of what we would want to include in this clinic. So Taylor kind of mentioned earlier having like a spa and a gym. So this would be a place where we can incorporate aromatherapy, so things like lavender, rosemary, eucalyptus, very calming and like can help with stress reduction, which we all know is super important, as well as facials, kind of going more into like the derm aspect of things with chemical peels, gua shas. Joanne mentioned a little bit also, hydrofacials, things like that can be really beneficial to incorporate into like acne treatments and things like that, as well as the like Marma points that Anisha's taught us about. And then also some herbal therapies that can be used for a wide variety of things. We talked a little bit about some for skin, some for inflammation. So aloe, chamomile, tea tree oil all can be used in a wide variety of derm conditions, especially things that are pro-inflammatory, so psoriasis, atopic derm, things like that. And then tea tree oil is pretty frequently used in acne treatment due to its antimicrobial properties. And then just for inflammation in general, turmeric, ginger, cinnamon, green tea, cayenne pepper, things like that.
Oh, so this one. Okay, also, I'm super interested in sports and injuries and pain and some of the things that we've discussed. We want to talk about injury prevention and athletic performance because obviously, nutritional recommendations are great for prevention of other diseases, but as well as injury is very important because once people aren't moving, then more serious negative effects can occur with their health. We want to address these high-risk individuals that could be experiencing injury in the near future. So our elderly, any like neuromusculoskeletal patients with like Parkinson's, for example, athletes that may be overworked, have some asymmetry, and children as well, doing developmental screening exams, joint hypermobility, really trying to get ahead of any problems that may be developing later on. Regarding education, we want to teach proper running and movement techniques just to prevent any type of harm that may, or injuries that may develop. Also having parent education for safety at home for their kids. We just want to make sure that there is enough education, people understand like potential risks that may occur and develop, just to make sure that their children don't end up having any injuries. At home, strength exercises, sleep hygiene, that we've also discussed, just to maximize recovery. And then some therapies that we've discussed in class: Tai Chi, yoga, stretching, some strength and balance training with PT, occupational therapy as well, and then some infrared therapy, myofascial release, acupuncture, which we'll discuss more.
So these are a couple things that we've talked about in this class that we think could be super beneficial for a lot of different patients. We could have them in our clinic, and then sauna also is something that people could bring outside and go to another sauna. So we know that the sauna is very, very beneficial for muscle recovery and pain relief due to improved blood flow. So kind of what Taylor was talking about a little bit with recovery and athletes and things like that. As well as there are a lot of cardiovascular benefits. So the heat in there is mimicking, exercise, getting your heart rate up, things like that. So it's been shown that several sauna sessions every week can be super, super beneficial for cardiovascular health. And then it also can boost the immune system by stimulating heat shock proteins, which is, immune system boost is something that we could all use. And then vagus nerve stimulation. So we talked a little bit about this last week. So as we know, there are several conditions that it is already approved for in use. Specifically, refractory epilepsy was the first condition that it was essentially created for that. And then also cluster headaches, refractory depression. It can be really, really beneficial for some of those patients who aren't responding to medications and who have been trying a lot of things. This can be a more natural way without just another pill or whatever to help them. And as we know, there's the original one that was a very invasive procedure, but now we have non-invasive VNS, and that's actually proven to be very beneficial. So that could be something to look into as well. And then, as we know, it's being researched for a lot of other conditions: PTSD, anxiety, chronic pain, and then, of course, one last mention: chronic itch. Couldn't have the PowerPoint without that. And then acupuncture, all of our favorite new things. So we have seen how this can be beneficial to a huge, huge variety of conditions. Basically, every specialty could probably benefit from sending their patients to an acupuncturist or having someone in-house. So we would want to definitely have an acupuncturist in our team that we could send patients to. So tons of different conditions here that you can see it's used for. So anything that is stress-induced, hormonal balance, that could be used for acne as well as OB/GYN patients, and fertility, menopause symptoms, PMS, things like that. A lot of GI problems, as we've seen, that's super beneficial. PM&R, any sports injuries, pain, neurology, same thing, kind of on the pain side of things, as well as like post-stroke rehabilitation. Immunology, different rheumatologic conditions, as well as allergies, asthma, things like that. And then I actually saw some things about like hypertension, improved circulation, so it can be beneficial for those patients. And then family medicine, just, everything, like primary care, they're going to send their patients for all of these things. And then a couple other things that I wanted to mention that we've talked about is red light therapy. And then we didn't talk too much in depth about infrared, but I wanted to distinguish that they are a little bit different. So both are forms of photobiomodulation. So essentially you're using a certain wavelength of light, it's absorbed into the mitochondria in different tissues depending on how deep it penetrates, and then that is transformed into energy, basically. So infrared over here, the wavelength is 700 to 1200 nanometers, which differentiates it from red light, which is 600 to 650. So red light is a lot more superficial. That can be used for skin conditions, wound healing, things like that. And then infrared goes a little bit deeper, more into the joints and the bone, the muscle. So that is really great for pain, arthritis, deep tissue healing, things like that. It's actually also being researched currently for IBD treatment. So we have a lot of GI modalities, which is great. So these could both be super beneficial for a lot of patients.